Good afternoon, everyone. Thank you very much for having me here. Thank you so much, Andy, for making this happen. You know, Andy and I met in LinkedIn 2 years ago, and since then we've been very good friends, and I still look forward to collaborating with you in the next 50 years as climate change and planetary health crisis unfolds, unfortunately. I'm here to give this presentation. I'm very glad to be at the George Institute. I'm a big fan of your work. And, you know, as Andy has just mentioned, this will probably be one of the last times when I'll be using the Harvard slide template deck because yesterday was my official graduation date at Harvard, November 12, US time. I'm from the Philippines, and in the next couple of minutes, I'll be sharing, you know, my perspectives as well as experiences, both in research but also in practice, because as you can see, my training at Harvard is a Doctor of Public Health degree, and I'm not sure if you're familiar with, you know, the distinction between a PhD DPhil versus a Doctor of Public Health, which is a more professional, practitioner-oriented focus on public health leadership and evidence translation. So that's my background, and you know, I'm always described as both a scholar but also as an activist. And so you might, you know, feel that in some of my slides, those are some of the vibes that I'll be conveying in this presentation. As I've said, it's great to be back. It's my fourth or fifth time here at Oxford. The first time I was here, I took a course here on non-communicable disease control and prevention under the Department of Population Health. That was spring break at Harvard, and I'm the only student at Harvard who took another class during spring break when everyone else is in Colombia or the Caribbean. And then I was here last year to visit Oxford as well. I visited Andy, but also I had this amazing conversation with Kate Raworth, who originated this framework, this concept of a donut economy, which I will be touching on in a bit. And you know, I'm going to talk about climate change, planetary health issues, etc. And I want to make sure that the room understands that this issue is both personal as well as professional. And I don't see any divide between the two worlds. You know, for many of our colleagues, this is perhaps an intellectual curiosity. It's one of the, you know, subjects of interest in research. But really for me, coming from the Philippines, one of the world's most vulnerable countries in the world, this is very personal when, you know, you see firsthand how climate change and other forms of environmental change affects not just your environment, but also your own people. And when I was a medical student back many years ago in the University of the Philippines, I was, you know, bringing fellow doctors and nurses to plant trees in deforested areas, or holding cleanup drives, or training communities on how to manage their waste properly. So that's, you know, really part of my early formation as a physician and eventually as a public health scholar practitioner. And then when I moved out of medical school, it was not surprising that I will be continuing this commitment to both protecting human health and the planet's health. It's as if I was, affected by this positive virus of, you know, caring for the environment and for human health. You know, I've been in the picture, you will see me with fellow advocates, you know, urging to kill coal because coal kills. And we know that it's because it's an important driver of climate change, but it's also a generator of particulate matter leading to high asthma rates in surrounding areas. And of course, you know, one thing that I'm known for, if you follow me on Twitter, Renzo Guinto, I urge you to do it now, is that I love selfies. And this is perhaps one of my most prized selfies with, of course, no less than Margaret Chan, the WHO Director General, that was taken during COP21 in Paris, and it became front page of the WHO website for a week. So, you know, that's my way of really communicating and connecting, not just to fellow public health leaders and practitioners, but most especially to the next generation. And I was having a chat a while ago with her friend who's the comms person here at the George Institute. And I told her, I have a slide for you, which is to emphasize the importance of communication in this day and age. And I always tell young students that maybe you're not in positions of decision making at the moment, but you can tweet, you can write a blog, you can write an op-ed for the New York Times or the Los Angeles Times for this matter. We can communicate this message. We can be messengers of this message beyond the medical journals that we're more familiar with. And I think we in the public health profession not just have this opportunity, but also this obligation to actually convey these messages to the greatest number of people, especially when we are told that we only have 10 years remaining to save the planet. And right now I'm transitioning. As you saw earlier, I'm now visiting fellow in Belgium until December. But I'm also incubating my own, what I call a PH lab. You said it's Planetary Health Lab, but also PH stands for the Philippines, which is my home country. And it's also public health, it's also population health, it's also the way we measure acids and bases. And I think in this day and age, what we need is to strike that pH balance, pH 7, where ecology and economy, where human health and planetary health are being addressed and protected at the same time. So I'm looking forward to more collaborations, hopefully with the George Institute. But this commitment to human health and the planet's health is not a new thing. It was not invented by Al Gore, not even by Greta Thunberg. Millennia ago, the father of Western medicine, Hippocrates, already instructed future physicians in his lesser-known text. We all know the Hippocratic Oath, right? Do no harm. And right now we're applying do no harm, not just to patients, but also to the planet. But he also wrote in this lesser-known text, as I've said, called Air, Water, and Spaces, or Places. And he said that we medical students should be studying the winds, the seasons, the composition of the soil, the design of our cities, because these are vital determinants of health. That was already instructed to us millennia ago. But over time, medicine has become a very reductionist, downstream focused, biomedical profession, and we've forgotten that the natural environment in which we thrive are critical for either the improvement of health or its own destruction. And we know there's so many papers that have been done trying to attribute population health. Is it caused by the medical care system complex? Is it due to behavioral factors? And there is somehow a general consensus in our field that really the social and the environmental determinants of health play a very important role in the production of health in society. So when I was a medical student, I chose climate change as the main pathology that I wanted to cure. Of course, as you get immersed further, you realize it's not as easy as giving a pill and climate change will be gone. It requires working with other disciplines, working with fellow advocates and researchers from other countries. Here, you will see me protesting in front of the University of the Philippines College of Medicine, quoting the Lancet 2009 report, climate change is the biggest global health threat of the 21st century. Fast forward in 2015, the same journal said that tackling climate change could be the greatest global health opportunity of the 21st century. That was a flipping of the messaging from focusing on the bads to focusing on the good that we can do as a sector to make a dent in this climate discourse. And very fresh, because right now as we speak, unfortunately I'm not in London, they're just launching the 2019 report of the Lancet Climate Countdown. Nick Watts, a very good friend of mine, interestingly, in this third version of this report, they are applying a life course approach, saying that children today will be the ones who will be affected the most by climate change. And the effects are varied across their life course. When they're adolescents, in 15 years' time, they will be facing, more flooding, more natural disasters. And when they are adults, 30 years to 40 years to 50 years from now, there will be more droughts. There will be islands that, perhaps are already erased from the face of the earth. So that is how climate change will be affecting the generation we have now and the generations that are yet to come. And of course, its editor-in-chief of the Lancet, Richard Horton, in May at the World Health Assembly, urged the member states, the ministers of health, to announce a planetary emergency. So very interesting that the World Health Organization, the World Health Assembly, talking about climate change, and before, maybe 10 years ago, it's even a non-agenda in the field, in the global health community. And of course, recently, Richard Horton also expressed support for Extinction Rebellion, urging health professionals to actually participate in nonviolent protests. And I love Richard Horton, and if Richard already is wearing a leather jacket as sleek as that, then it's really something very serious. And we should all be considering, his prescription. Okay? So now in switching gears, now you know where I'm coming from. Now you know a bit of, the context, the milieu where we're in now. I want to focus a bit on my home country, the Philippines. 2 weeks ago, I gave a lecture at the Philippine Embassy in Berlin at the sidelines of the World Health Summit. And I use this phrase: the Philippines is at the heart of planetary health. Not just because they share the same letters, PH, but really the Philippines is a country that is both a planetary health hotspot, but also has a huge potential to be a leader in this emerging planetary health movement. So Kent Carpenter, a renowned ecologist, described it as a center of the Center of Biodiversity. A climate and health hotspot, as always in the top 5 of the Climate Risk Index. I always joke, we're always top-notchers in boxing, in Miss Universe, but unfortunately also in climate risk and disaster vulnerability. 20 typhoons each year, now more in number, and now stronger in intensity. The fastest rate of sea level rise, 5 times actually than the global rate. World leader in climate policy. There was a time when the United Nations described the Philippines climate change laws as the best in the world, with strong emphasis on both mitigation and adaptation. Of course, the challenge is, how are you going to implement it? Is the implementation apparatus, whether it's government or the broader society, ready to actually execute its aspirations? And then it's an early adopter of the climate and health agenda. As early as 2009, there were already, policies put in place emphasizing the role of the health sector in building climate resilience. Of course, again, these are expressed goals, and the challenge for me and my generation and the generations to come is to make sure they are turned into reality. Right now, the country is also in the middle of this journey towards universal health coverage. Ensuring that healthcare is accessible to all without the risk of financial hardship. But UHC in itself will be very much threatened by climate change and all its effects in the years to come, exacerbated by the limited capacity to implement and the scarce resources, financial or even health workforce-wise. And then you see typhoons. Typhoons is how we call them in the Pacific. In the US, they're called hurricanes. But basically, typhoons now are almost as big as the country itself. If typhoons like this pass through the country, it will be totally erased for a day. And this is Typhoon Haiyan, which hit the Philippines in 2013, the biggest typhoon, the strongest typhoon to ever hit land in recorded history. And what happens when climate-related extreme weather events do hit countries like the Philippines? All these life-supporting systems, food, water, education, livelihood, and healthcare systems are disrupted, paralyzed, if not totally destroyed. And I remember the day after when Typhoon Haiyan hit the Philippines, in the front page of our national newspaper, it says, it's the worst disaster to hit PH, which is, as you know, the Philippines. But I think as a physician, as a public health professional, it's the worst disaster so far to hit PH, the people's health, public health, and maybe even planetary health. So I've mentioned to you already about the fast rate of sea level rise in the country. And this is a familiar slide, maybe, for those familiar with climate and health literature, from the Lancet 2015 report. Two key messages: climate change and health are linked in so many different ways, through many different pathways, whether it's through heat waves or flooding or storms. And the other main message here is that climate change, or no single disease group is immune to climate change, whether it's non-communicable diseases like respiratory cardiovascular diseases, which can be exacerbated through intense heat, or infectious diseases like malaria, which is, in some parts of the world increasing rather than being close to elimination, again due to changes in the climate and even other environmental factors. Mental health also, there's a growing evidence on its links with climate change. And then in my dissertation, I tried to localize that diagram, which is applicable to the world. This one shows to you how the Philippines is affected by climate change, or the Filipinos' health is affected by climate change. Of course, we're not very much concerned about allergy seasons being altered because of the changes in the pollination patterns. But in the Philippines, we have dengue, which does not exist in the UK or in Europe, although there's some evidence, I think, that dengue is now, showing up in some parts of, the global north. But you also have, for example, in the anticipated box, hypertension resulting from increased salt intake, not from food intake or food consumption, but because of the consumption of highly salinized water as a result of seawater intrusion to the groundwater. So these are some of the issues that may be a bit different from what's happening here in Europe, but all of these health effects are driven by what's happening in the environment. So for example, in my research, I did 2 case studies of 2 coastal municipalities in the Philippines, and these are some of their shared characteristics. And so this is the chance for me to pause and recover my increasingly getting hoarse voice. But I want to show to you my first film. So Andy did not tell you this is going to be a combination of lecture and film. When I was doing my dissertation, I realized that my 200-page dissertation will probably be read only by 3 people, and that's my committee, unless I turn them into digestible publications. But if I create films out of my case studies, they can be viewed by many. And as we speak, they've been viewed 10,000 times in social media. In fact, even, reaching some UN officials who invited me to Geneva, who invited me to give a talk in Thailand in January. So it just shows how powerful these new forms of communication are. And that is an invitation to all of us scholars of public health to expand, our toolkit in terms of conveying our messages, not just to policymakers, but to the world entire. So I'll show to you this first film. I hope you'll enjoy it.
What I understand of climate change, the cause is the increasing concentration of greenhouse gases in the atmosphere.
Climate change is nothing more but the effect of the abuse of our environment. Mother Earth is already asking for rent for the space that we are occupying.
Majority ng barangays natin is coastal barangays. So prone po sila, hindi lang po sa bagyo, sa storm surges, at saka sa sea level rise.
Dati malaki pa itong isla at saka maraming tao dito. So ngayon, maliit na lang space namin. Siguro mga ilang metros na sigurong kinain ng dagat.
Idagdag na rin natin po yung saltwater intrusion. Yung mga deep wells nila ay napapasok na po ng saltwater. So hindi na po yun potable.
Wala na kaming matayuan dito ng bahay. Dati may lugar pa kami na matayuan sa gilid ng dagat. Sa ngayon, medyo mataas na. Bali, high risk na kami.
A big majority of people in Ahoy are working in agriculture, farms, fishing. They force themselves to really work under the sun, so they get sick.
The fisherman knows how to predict the weather by just looking at the leaves of the star apple. Unfortunately, it doesn't work right now.
Tapos kung mga tagtuyot, hindi sagana yung ng mga tatanim ng mga palay.
What guarantee do you have that today, this year, we are going to have a good harvest? Next year, we're going to have a very scarce harvest.
Because of climate change, yung mga seeds natin hindi pa resilient po sa hotter weather at saka intense rainfall.
With the increasing population, more demand for environment, resulting to climate change, resulting to problems in health.
Kung tagbaha, maraming sakit na pwedeng lumabas dyan, lalo na pag yung mga tao na sa tubig, like mga leptospirosis or mga skin disease po.
Before the Yolanda, nobody really takes climate change seriously.
Kahit ako, nung time na to, parang hindi ko lubos maisip na mangyayari. Talaga ay yung gano'n, nakala ko sa lang, sa mga pelikula lang.
So we knew it like maybe 10 days or 2 weeks before that there might be a super typhoon coming. We really did not bother to prepare because we did not believe.
Bubong ng aming RHO, natanggal na.
Nung nahupa na yung tubig, marami ng pasyente na pupunta dito, puro mga sugat.
Hindi naman kami maka-refer sa hospital kasi yung daan, hindi naman madaanan kasi maraming kahoy na nakaano sa daan.
Yung isa kasing pasyente na dito lang dinala, patay na yun eh. Mayaan yata ng kahoy sa sa ulo. Breadwinner ng pamilya.
I think we are on the right track right now because of our Yolanda experience.
I think we are more prepared.
Handang-handa na po. Dati kasi, yung mga BHW, hindi pa sila masyadong tinitrain kung paano yung mga basic na gagawin, like mga first aid.
Kung climate smart, yung isang health system, yung dapat kailangan i-provide regarding sa health, so dapat andoon na lahat-lahat.
Yung mga bahay po sa island barangays natin, may mga rainwater catchment system sila.
For disaster, we have volunteers. We do drills in the municipal building, in the schools.
So yung mga priority projects po na-identify nila is yung stockpiling po ng goods. So next is equipping po ng ating emergency response, like communications equipment.
If you talk about climate change, it should be the concern of all the agencies. It should be the concern of whole community. It should be the highest priority of the LGU.
Yung DRR plan po natin, ginawa po yun kasama po ang iba't ibang sectors natin. Yung council natin is made up of all the department heads, especially health, agriculture, DSWD.
In all areas of governance, the people really are the most important.
It's easier kasi pag maintindihan ng community and they're part of it, of implementing the program.
The people are the supreme authority of what they need, of what they plan for their future.
Ang community po mismo ang gagawa ng hazard assessment nila. So ma-identify nila kung anong hazard ng kanilang community at saka sila din po ang mag-identify kung anong solusyon dito.
It should not be a piecemeal approach. It can never work if you are going to approach it in a 1-month program or in a 2-day seminar. It has to be walked through for the whole year.
Hindi po porket binahaan tayo ngayon, gagawa tayo ng program next year para sa baha. Kundi we look at 5 years from now, 10 years from now, to 25 years from now.
We are a little bit lucky because we have a leadership that is attuned to the times. We are not planting trees for the present generation, but for the next generation.
Last year, we launched Project Happiness with hashtag such a joy to be here. So we want Ahoy to be a better community, a happy community.
Climate change is good politics because whenever you talk about climate change, you are talking about lives of people. You are talking about stomachs of people.
Yung vision ko sa Ahoy is not only magiging victim po yung community natin. They are more than that. They are strong. They can prepare.
We do not have any choice but to confront it and prepare ourselves, prepare our people.
The show must go on.
The show must go on, so we will continue. Two things. One, I want to remind you, I did a doctorate in public health, not in filmmaking. And number two, none of this is scripted. It's part of the research methodology to actually, interview and get perspectives and do field observations with a camera crew following me everywhere. So that's Ahoy Iloilo. We talk about climate change, but we have to be reminded that climate change is just one of these many changes that we're seeing. Many of them, if not all, are anthropogenically driven because of our human activities. And I'll not go into detail, but it just shows to you, our consumption patterns, demographic shifts, population movement, and technology. Technology has offered us both good things and bad things. And all of these are, downstream, leading to a lot of health outcomes. And, this one is from last year. There's a latest study that, says maybe one, we're underestimating climate change, the rate, the speed, and also the intensity. But number two, climate change is not just, a worsening of the greenhouse effect, but it's also a hothouse Earth that is really being manufactured, because a hothouse, unlike a greenhouse, and people from agriculture, you might be familiar with what a greenhouse does. A hothouse is an uncontrollable system of continuous heating, and it just drives a spiral of events. As you can see, all these events, whether it's the burning of the Amazon or destruction of the oceans, and they just keep on adding and adding on each other with cumulative effects, and the 2 degrees Celsius is actually a 4 degrees Celsius rise. So that's what's going to happen, and the public health community has to hear this evidence, because at the end of the day, we will be bearing the brunt of the health consequences of these never-ending spiral of a hothouse. So, as I've already emphasized the anthropogenic nature of the challenges that we're facing. And of course, Sarah is familiar with this. We now live in this era called the Anthropocene. That was the proposal. I have a friend here who's a geologist, and I don't know what's his take on this proposal to rename or to create a new epoch called the Anthropocene, where humanity is the biggest force that shapes the face of the earth. We're gone are the days of the dinosaurs, Jurassic, the Ice Age. It's really humanity that is shaping our planet today. We're humanizing this beautiful planet. And that is why the Lancet and the Rockefeller Foundation initiated this new concept called planetary health. And I'm pretty sure you're familiar with this phrase. I have some slides to just review us about it. Of course, I invite you to read this text, and the lead author is sitting there, which I am privileged to meet for the first time here. And really, planetary health is the health of people and planet. That is how I see it in its simplest form, which is totally different from public health, which is about the health of people, period. And it's about the health of people, oftentimes at the expense of the planet. That is how public health and society at large have evolved over the years, over the past century. And so this is really a call for us to reorient our sector, to reorient ourselves, and to reorient basically our society to ensure that we protect health and advance health of people while protecting the health of the planet as well. This slide I just want to show to you, and I always say that planetary health, emerging field, emerging community, like any field, it's still in an identity crisis. It's confused. Is it a new field? I want to hear your perspectives on this later, but is it a new field, or is it old wine in a new bottle, right? Is it a new policy frame for discussing health issues in the era of the Anthropocene? Is it, a new scientific paradigm? Because, for centuries, science is always around objectivity and neutrality. But now we are, there's a sense of urgency and an extra concern for both equity and sustainability. So which are not necessarily called scientific before. And of course, is it a new communication strategy? Is it a way to communicate climate change and other environmental health problems to the next generation? I will not resolve that issue, but it's important to just see the multiplicity of perspectives around this new planetary health paradigm. And this is also a simplistic way of showing how, planetary health has evolved and continues to evolve. You will see on the one hand, the evolution from tropical medicine. It's about the health of colonizers in the colonies. And then it evolved into public health, which is the health of people, let's say, in a city, like what Jon Snow did in London, to international health. Now we have to be concerned with the health of our former colonies, and we need to make sure they are able to catch up with the advancements in health in the global north. And then you have global health, a recognition that diseases do not respect national borders, and the health issues in the north are also health issues in the south. Unfortunately, that's nice on paper. The way we operate global health is still very much colonial. And if you follow me on Twitter, one hashtag that I started is this hashtag called decolonize global health, which is an emerging conversation, especially among the emerging scholars and practitioners like me, who are now better equipped, but who are also now seeing firsthand the defects of the current global health architecture. And so we are inviting a re-examination and even a reimagining of what global health should be in the 21st century. And maybe that's planetary health, the global health 2.0, 3.0, whatever. On the other hand, you will see environmental health and its related disciplines, how they evolve. Envi health, I would say it's the mother discipline, but what happened to it is over time, it has become reductionist and linear, trying to identify the specific toxin and how it leads to a specific syndrome. The effect of lead on autism, the effect of particulate matter on asthma, or even just wheezing. So, it has become reductionist, and then eventually the veterinarians realized we want to be working with a human doctor still. And that's how One Health evolved, looking at zoonosis, food safety, and most recently, antimicrobial resistance, which I think is another major planetary health challenge. Eco-health evolved because of the environmentalists also trying to be part of the family. And most recently, geohealth. My geologist friend was also talking to me about it a while ago, how, the composition of the soil affects nutrition outcomes, to how volcanic eruptions lead to certain health consequences. But what I'm seeing now, or maybe this is wishful thinking, is that these two streams will converge to form this new planetary health era, where the health of people and the health of the planet are equally given attention by the same sector, which is the health sector. In fact, maybe if our vision for health is it's the health of people and planet, we should just call it health, right? And well-being of everyone, of every creature, great and small. Another way of looking at how these are all related, animal health on one hand and public health on the other hand, they converge and they form One Health. And then eco-health is looking at these diseases in the context of an environment, whether it's a forest ecosystem or a coastal area. But planetary health looks at the interface between human societies and the ecological systems, the broader ecological systems. And that Lancet report that Sarah led definitely enumerates all these planetary health issues that are covered by that circle. But I always remind, my colleagues at Harvard, some of my friends from the Lancet Commission. I'm not part of the commission, but I am perhaps one of the early adopters of their vision. I always remind them that planetary health is not their original, okay? We have to give credit to whom it's due. And indigenous peoples of this planet have for millennia been telling us and reminding us, they've earlier already recognized that the health of the people and the health of the planet are deeply intertwined and in fact inseparable. Chief Seattle, an indigenous leader from the States, said, the earth does not belong to man. Man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. Doesn't that sound planetary health? And of course, in planetary health, we always talk about creating that safe operating space for humanity. And this is an idea that our friends from the Stockholm Resilience Center put forward. And they came up with this framework called the Planetary Boundaries Framework. Who among you is familiar with this framework? Apart from Sarah. Okay? And basically what the framework is saying is that there are 9, at least for now, planetary boundaries that we cannot breach. Because if we violate any of them or some of them, the world will be less inhabitable for human survival. And as you can see, 2 have already been violated, the ones in red. Biosphere integrity. This past century, we've seen the fastest rate of extinction of creatures great and small, but also the alteration or the disruption of the natural biogeochemical cycles, particularly nitrogen and phosphorus. And guess what is the reason why these natural cycles are already being destroyed? Agriculture, our incessant use, addiction to artificial fertilizers, etc. And then you have other planetary boundaries that are close to be breached, including climate change. And I'm bringing back Kate Raworth, who I first met here at Oxford, who also conceived of this idea. Sure, we cannot breach the planetary boundaries, but we also have to make sure the social needs of humanity are being met, whether it's health or education, women empowerment, or political engagement. And that is why she developed this donut. She actually apologized to me, Dr. Renzo. Perhaps I chose the wrong metaphor because donuts are unhealthy, But I told her, maybe this is the healthiest donut that has ever been conceived. And so, what the framework is saying is that we should remain in that safe and just space for humanity inside the donut. And I firmly believe that this perhaps is part of that planetary health vision, Planetary health is not just about the diseases that we need to eradicate or the environmental phenomena that we need to deal with, but we need to also ensure that the future economy will be conducive for planetary health and not planetary disease. So, and we can talk more about this framework in a bit. And our friends from the University of Leeds did this study. They tried to assess which country in the world is closest to becoming a donut country. And usually I give this as a multiple choice exam to my students, but I will give you the answer. And it's very obvious. The country that this report considers as the closest to the donut is Vietnam. That has breached only one boundary, climate change, and not as huge as what US or the UK, our country, have done. But also, it has met some, not all, of its social foundations, its minimum social requirements. Of course, we need, as a Southeast Asian, with Vietnam as our neighbor, we need to keep to look at this with a very nuanced view. It's not saying that, every communist country will become like a donut, right? But I think the question that we need to be asking is, how can we become Vietnam? How can we become a donut country or a donut planet, regardless of the pathway? Or maybe there are 1 or 2 pathways that will lead us to achieve that goal. And that is a conversation that needs to happen. And then in planetary health, I already mentioned a while ago, there's a special concern for equity. Because all these planetary challenges, all these planetary changes, climate change, ocean acidification, they will affect everyone, north and south, rich or poor. But as you can see, sometimes, most of the time, when an environmental change occurs, the rich and the middle class, the rich countries with access to resources, they're able to cope with all these changes and even be better societies because of those infrastructure and resources. Unfortunately, the poor, they're already poor, will become even poorer because of environmental degradation. They don't have access to life-supporting assets. So really, planetary health cannot neglect that unfinished business of equity and justice. And as an example, this is climate change, just focusing on climate change, and this is from WHO. The top map shows to you the parts of the world that have emitted the greatest amount of greenhouse gases into the atmosphere. North America, Europe, but at the bottom you will see the parts of the world that will bear the brunt, the health brunt of climate change. Unfortunately, it's Africa, it's many parts of Asia, and the Pacific, which are too small to be zoomed in. In fact, they probably are inundated in this future state of climate change. So in Whitney et al. 2015, they talk about what are the main challenges that we in planetary health have to confront. And it's not just about the diseases, it's not just about the phenomena, but it's really about these three main challenges that cut across issues. Conceptual and empathy failures, which they also called imagination challenges. It's just so hard to imagine how an occurrence in the stratosphere affects certain nutritional outcomes. The causal pathway is just so long. And I would love to hear the epidemiologist's perspective on this. But also, we have very little imagination in terms of how we measure well-being and health. What's the common metric now when we compare countries in terms of societal progress? Gross domestic product, right? Which totally does not capture the full breadth of societies, their health, their education, human capital, and the environmental assets that they have. Knowledge failures, Planetary health is inviting us to really question the way we do research, the way we ask questions, the way we address complexity. Okay? There are knowns, there are known unknowns, but there are also unknown unknowns that we need to take into account, especially in decision making. And then finally, implementation failures, governance challenges. The design of our governments, the configuration of our economies, they're totally incompatible with the nature, the magnitude, and the urgency of our planetary health challenges. So this is an invitation for us to imagine alternative futures. What is the future economy? What is our future society? And I hope that the health people will be active participants in that conversation. So yesterday, and I just want to make sure I have time, I gave a lecture at King's College, London, and they asked me to talk about planetary health, but with a focus on governance. And this is the title of my presentation, what future governance for the health of people and planet, Is this saying that we will not be concerned anymore with obesity or Ebola or universal health coverage when we start building planetary health governance? I don't think that is the answer. I think there's still part and parcel of planetary health. But planetary health, as I've earlier emphasized, is a new frame for discussing. And if we discuss universal health coverage or hypertension control or vaccination in the era of planetary health, how would the conversations look like? Will that only be about, is Gavi putting a lot of money in vaccination, or should we try looking at, for example, ecological approaches to addressing infectious diseases? And this is one of my epigraphs in my dissertation. Anthony McMichael, climate and health pioneer, one of the first to acknowledge climate change as a health issue. He said that the health sector must lift its gaze to bigger ecological horizons. This will require a radical extension of the public health agenda. I think that's planetary health. New forms of professional training in environmental health. In fact, it should be every professional, even those outside of health. A preparedness to base policy advice upon predictions and best guesses as opposed to empirical data. And that's a challenge for places like the George Institute, which has made a commitment to rigorous evidence generation. But now you're faced with uncertainty, the unknown unknowns that I was talking about. and an ability to collaborate with unfamiliar disciplines, climatology and ecology. How is the George Institute working with, for example, the School of Geography and Earth Sciences that my friend is a part of? And then when we talk about planetary health governance, we have to think of all levels, the global level. And, you know, we're now more familiar with WHO, a bit of the World Bank, because they, you know, give loans in exchange for some conditionalities that really, you know, disadvantage a lot of people in poorer countries. But how about the World Organization for Animal Health? Have you heard of this organization? The WHO for animals. Basically, that's what it is. So maybe it's time to look for unlikely allies now that we live in the planetary health era. And, you know, COP25, as we know, is now moved from Chile to Madrid. And I remember in COP something in Copenhagen, they used to say that the climate and health advocates can be fit in a telephone box, like the ones you have in London. But now you have an annual climate and health conference at the sidelines of COP. So we need more engagement with these other allies. Richard Horton would always say that the SDGs, the Sustainable Development Goals, are is a language of planetary health. But is this really a blueprint for advancing planetary health in the era of the Anthropocene? That's a question, right? And of course, it covered some of the planetary health issues that, you know, the Lancet report, for example, enumerated. But if we need to think beyond, you know, what should be the new blueprint? What should be the new, maybe yesterday there was someone who asked me, what's the Marshall Plan for planetary health? And talking about the Marshall Plan, you know, planetary health really opens up new forms of challenges that we've never seen before. Islands, countries disappearing. I only learned about countries moving, you know, when I was in high school, you know, how the Pangaea broke up into several continents. But now you have islands becoming inundated and totally erased from the face of the earth. And as a result of that, people have to move. Migration has already been happening for centuries, is still happening today, and will continue to happen. And until today, we see migration as a problem that needs to be solved, when in fact it is a natural phenomenon that we just have to deal with and work with. And I really don't like the term climate refugees, because the Refugee Convention is about, you know, people moving, fleeing countries where they're from fleeing countries with persecutorial governments, conflict, war. They're not leaving a country because of those reasons. They're leaving because of environmental phenomena that is induced by our own actions. It's a totally different class. It's a class of its own. We don't have an international instrument to protect these people from the Pacific and other small island developing states, which I actually just learned recently. They don't want to be called SIDS, or small island development states. They want to be called large ocean countries. Because for them, their territories are not just the islands, it's the oceans. And so if they flee these islands and go to, let's say, New Zealand or Australia, who's going to exploit these oceans that used to be part of their own territory, where they used to be sovereign owners and stewards? And I invite you, for example, we're talking about global health governance. I was at the World Health Summit 2 weeks ago, and I wrote this op-ed, is the Planetary Health Summit already born? Because, you know, the World Health Summit started with, you know, saying planetary health is the main determinant of health in the 21st century. And then you will see in my blog, I talk about how the planetary healthness of the summit slowly disappeared as the global health community returned to business as usual, talking about the things that we are comfortable with. So again, we're paying lip service to planetary health, climate change. It's still the icing on the cake rather than the chiffon itself. So, and maybe we should not just be thinking of WHO as a planetary health organization, but maybe it's the whole UN that needs to be fixed. Especially when you have the UN Sec Gen already calling for, you know, a climate emergency. And then when we talk about planetary health governance, we cannot anymore ignore that it's not just about the people who are living now. It's also the people who are young, the children and the next generation, but also the unborn. There's an intergenerational dimension to this. And so I remember in 2013, I was part of a Lancet Commission on Global Governance for Health. And we young people, we have a small youth commission shadowing the main commission. And we urge that there should be an ombudsperson for your future generations in the United Nations, to be the spokesperson for all the concerns of the kids and those that are yet to be born. Of course, we need to think of planetary health at the level of national government and governance. You have health systems that are as complicated as this. This is in the US. Of course, we know, most highly technologically advanced, but also the most inequitable and most inefficient and most wasteful health system in the world. But if we're going to turn the health system into a planetary health-oriented health system, how will it look like? We probably will have more players, and probably we'll be changing some functions. We've always paid lip service to health in all policies, intersectoral action for health, since the Ottawa Charter of 1986. And we've never mastered how to work with other sectors. We always have 10 case studies in a WHO report on how obesity was, fought, by working with other sectors. We can't keep on finding case studies. It should be the norm. And planetary health gives us an opportunity to actually rethink the way we work with other sectors and perhaps to even play a leadership role in society as opposed to just being a mere participant. And of course, you have all these interesting developments, the rise of new dictators and autocrats and right-wing leaders, and this allergy towards integration and being a global family, and more tendency towards separation and isolation. When planetary health calls for more cooperation, for more solidarity. So this is, I think, a planetary health challenge in itself. And then finally, as you've noted, when I was thinking about my doctoral dissertation, should I focus on the global? Should I focus on the national? I decided to focus on the local. Because while there are problems in all these levels, I felt that there's very little attention given to the front lines, who will be the ones to first encounter the early manifestations of climate change. So we know very little about their adaptive capacity, about what they're doing, and I asked the question, are we ready to build health systems that consider the climate at the local level? And there's so many frameworks that have been made by WHO, by World Bank. No one uses them. For example, this idea of a climate-smart healthcare, the convergence of mitigation. How can the health sector lower its carbon footprint as well as adaptation? How can we be ready for this new normal of climate-related health impacts? And this is the framework that I used. And one thing that I want to emphasize, I did not just look at the health system. I made sure that I looked also at what I call systems for health, which are the other sectors. Maybe here you use the term social determinants of health, but really they are systems in themselves. And eventually they contribute either to the creation or the destruction of health, but also these systems for health are affected by climate change in themselves, whether it's agriculture or environment, etc. And so, I came up with this schematic. What should be the health system be doing to address climate change in terms of reducing its emissions, in terms of improving health, population health baseline, because both based on evidence, but also based on intuition. If the population is healthy, there's higher adaptive capacity to combat the effects of climate change in the years and decades to come. How can the health system improve its performance so that, the hospital is the last building standing when a natural disaster occurs? And, in my case studies, like the video that you saw a while ago, there are several determinants of adaptive capacity that I drew. And material assets, which we tend to focus on more, is just one of them. Because there are what I would call software as opposed to hardware elements like social capital, leadership, the intelligence of the system and its people, and most importantly in the middle, positive values. The values toward equity and sustainability and solidarity. And I also unpack what are the tensions that health systems encounter, building new capacities to address these new threats versus improving existing capacity to ensure that the unfinished business of maternal health, child health, infectious diseases are addressed. So I'm not going to detail, we can talk more about this in a bit. And I always emphasize as well that climate action and universal health coverage are deeply connected. They will need to prioritize both agendas. And it's not, on September 25, the UN held the high-level summit on UHC and the climate summit on the same building in the same day in New York. But there was little osmosis that actually happened between the two conferences, which is a shame. And so I think the public health community should, communicate the marriage and the intersection and the connection between the two. We need climate action so that our UHC systems will not be overburdened by excess diseases and deaths. 250,000 deaths annually from 2030 onwards, as predicted by WHO. But also we need to make sure that UHC is climate-proofed. We're talking about sustainability of UHC now, where we are getting the money from, etc. But we need to make sure that UHC is here to stay, especially in the world of climate breakdown. But we're not yet discussing that aspect as well. And I think we have the international policy environment for that. These are some of the, from the SDGs, the Paris Agreement, the recent Astana Declaration on Primary Healthcare, all of them are talking about the importance of strong health systems in the era of climate change. It's really just a matter of execution and implementation. I'll skip this, and I just want to show to you the other film. How many minutes do we still have? Yep, I don't have a timer here. So I'll show to you the second and the last film. I'm still editing the third one, not part of my dissertation, but I thought, if Tolkien has a trilogy, Lord of the Rings, I should have a trilogy, a planetary health trilogy as well. So I'll show to you this film, and I'm going to my concluding remarks.
Ang pagkakaunawa ko kasi sa climate change, gawa kasi siya ng tao.
Your regular climate behavior that you are anticipating, biglang nagbago. Kami, naranasan talaga namin yung impacts rin of climate change, which includes the sea level rise, may coral bleaching, may drought.
Dahil ito ay coastal areas, alam ba nila natataas yung level ng dagat? Kung uulan, mas matindi yung precipitation. Kung mag-init, mas prolonged period of drought.
May mga corals daw na siguro sa increase ng, di natin alam, if sa temperature yan, nasisira.
Dahil sa sea level rise, yung mga bahay nila ay abot na yung mga sahig nila.
Dati, kung ganito lang yung kadami ng typhoon, ngayon, iba na, mas madami na.
We were supposedly the first to be hit. We knew the mangroves will protect us. Kung bumagsak yun dito, sabi sa amin, based on simulation, 60% of us would have been gone.
If the problem will occur today as of this moment, parang hindi. Hindi, kasi marami kasi kami kakulangan. Ang pinaka ko talagang manpower, wala din kaming ECG, wala kaming CT scan, wala din kaming X-ray. As a doctor, ang malaking epekto ng climate change sa kalusugan ng mga tao.
Rampat, yung dengue, at saka yung amoeba.
Hindi nakasanayan yun sa mga tao na iniinom. So kung yun ang iinumin nila, mag-iba yung stomach nila.
Tayo ang gumagawa, tapos ang epekto, tayo din ang nag-harvest. Tayo ang gumagawa talaga ng sakit na
If your island community will become more inaccessible, how will you design a health system in that area? So what we did, accept na kada isang barangay, our communities, they have different health needs. And because they have different health needs, iba-iba yung approach mo.
Si healthy yung magko-complement kung paano maging malusog yung mga pamayanan pagdating ng climate change.
Your local health system has to really be climate adaptive. It has to be because the changing climate will have new health challenges. And every new health challenges would require a new system, a new solution to resolve it. So it's evolving.
Pag sabihin natin climate smart, hindi siya madadaan kung gaano kayaman ng munisipyo, kundi ito ay madadaan kung paano ba maka-cope up si community sa mga impact ni climate change.
We thought initially it's all about infrastructures and systems. What we realized, it all boils down to basic values. How do we now translate values to become part of your systems and structures?
Mas better na mag-expend tayo ng millions of money for preparation, not for the response.
All of our multi-purpose centers can withstand up to typhoon signal number 4. To protect landslide, isisimento mo talaga yung road. So, it becomes access to health. But it's a climate mitigation as well.
Ang food security, kahit walang dumating na mga goods galing sa ibang probinsya, kaya naming mabuhay.
We're also building one of the first climate field schools for farmers and fisher folks. Is to capacitate the farmer and the fisherman how to do it right if your climate is like this. Your communities, they know more than you do. Then your role becomes a facilitator. Allow them to develop a system that allows adaptation, innovation all the time. Kasi nagbabago yung sakit, depende sa klima mo.
Yung indigenous at science, pagsabayin mo dun, andun yung masasabi mong innovation.
How do you make the right decisions? Babalik at babalik ka sa science. Kaya, yun din isang ina-advocate namin, science-based governance. We now have data to make better and more informed decisions of how to change and adapt to reach our targets, our vision. The problem is, it changes all the time. We live in a world of uncertainty na eh. The only certain is that you have the capacity to address the uncertainty. The local government's at the forefront of climate change. The national government is so far away. If the drought happens next season, they simply go to the local government. That's the structure of, our society.
Pag healthy yung environment mo, natural na healthy din yung mga tao. Pag ang mangrove management mo ay maayos, pag merong bagyo, merong storm source, yung mga tao ay maayos sila.
Their climate adaptability, which started from us understanding yung vulnerabilities namin, to preparing survival, to now having quality of life. Just preparing for the future. Climate change was never a threat to us. Kesa katakutan mo siya, may mo na siyang kakampi. That's why it's an opportunity to do something better.
So they were even considering climate change and planetary crisis as potential allies. Okay? So, and of course, when we talk about governance, I'm also talking about the governance of the planetary health community. And I remember being the only student in this room at the Rockefeller Foundation, I was urging them, we need more young people, especially because planetary health is really the community and the movement for the future. So, we now have an annual conference, we have a journal, we have, an alliance, we're inviting you to be part of it. But also, I think we need to be better, especially in this era of planetary health. We don't repeat the same mistakes of global health as we build our community, strengthen our institutions, and engage in research and practice. And, there were ideas already about what planetary health education should be. And I'll not go into detail. You can check this publication. But I'm also trying to build, and this is my practitioner side, what is planetary health practice? There's so much obsession, and the gaze is focused on planetary health research and education. But what is planetary health practice? And I think it's composed of 7 I's, institutionalization. How do you put it in, really rigid and even antediluvian institutions that we have, whether in government or in the private sector. Integration of multiple policy areas. Investment. Do we get money from the health sector? Do we get money from the climate sector? Information, bringing together multiple sources of information, health, climate, urban information from cities. Innovation, what's the role of entrepreneurs and businesses? Or should they be prevented from participating in planetary health because they're more or less accomplice to the crime? Implementation, how do we implement complex interventions which brings together health systems and even ecological interventions? But most importantly, planetary health inspiration. Someone told me maybe it should also be instigation. But what I am referring to here is how do we communicate, how do we spread the virus of planetary health to the world while instilling fear, but also instilling or inspiring hope. How can we turn this focus on health impacts into the health sector, making an impact to this planetary crisis that we're facing? And I always remind that in our work in planetary health, let's not forget about the communities that are in the front lines. Oftentimes when we're in the ivory towers of Harvard and Oxford, we forget that these are not just recipients of the knowledge that we produce, but are potential equal partners in the improvement of health of both the people and the planet. And this is also another missing conversation in planetary health from my perspective. I just came from the Planetary Health Conference at Stanford, and we're still not yet talking about the economic engine and the political machinery that drives planetary health destruction. And I look forward to hearing about the work of the Rockefeller Economic Council on planetary health that is based here at the Oxford Martin School, if they are progressive enough in trying to shift from this linear, this limitless growth paradigm that our departments of economics have been teaching us for decades, and moving towards a donut economy that ensures that respects planetary boundaries but meets society's needs. What good does it do to treat people's illnesses only to send them back to the conditions that made them sick? This was asked of us by Hippocrates. This was asked of us by Rudolf Virchow, the father of social medicine, that we need to address the social factors that affect health. And now we are called once more to go beyond the clinic and the hospital and to really address the root causes, the causes of ill health. We don't want to be this doctor giving the cough syrup, ignoring injustice and poverty and environmental degradation. But the 21st century doctor is a solar panel hugger, like this doctor. Okay? And we need to be doctors, planetary doctors, who will care for the health of both people and the planet. I just want to share with you, this is my last slide, a manifesto that I made when I defended my thesis at Harvard. And this is a personal commitment, my planetary health purpose, as I call it. Devotion to systems thinking, cross-sectoral work, and innovation. I always say, I always feel thrilled when I'm the only doctor in the room and I'm surrounded by people smarter than me from other disciplines. Because when disciplines come together, that's when innovation and great ideas emerge. Deep concern for the health, not just of people, because I'm a physician, that's natural to me, but also of the planet, with equity and justice at the heart of my work. And commitment to translating knowledge into action and delivering concrete results. We want to make sure that the knowledge we generate really impacts real lives in the service of the world's poor, the vulnerable, and the marginalized. Health is not everything, but without health, everything is nothing. Let's all be planetary healers. Thank you very much.